our last story in this section, and we go to the Daily Mail. And we've got too many overweight soldiers brings a new meaning to the term heavy artillery.
Very good.
A
quarter of Britain's... No, it was very good. A quarter of Britain's soldiers are classed as dangerously overweight in the past 5 years, and more than 5,000 have been discharged for being overweight and obese. One was a staggering 30 stone.
Big Dave.
I would use him as a bomb. Basically, I wouldn't. I'd just drop him as like a Dan Busters bomb.
Correct. I mean, he'd be a pretty decent human shield as well, wouldn't he?
Yeah, I think it's just a ploy.
Family 4 behind him.
They're cutting numbers, so they're just making them bigger, right? I think that's the ploy. But yeah, it's quite.
I mean, this is Eddie. This is actually a national security concern, isn't it? Not only is obesity wrecking the NHS and affecting public health, but it's possibly making us less safe now.
Well, it could be, but there's also there's a guy here, Farron Morgan. What a name, Farron Morgan. Who's a lance sergeant in the Coldstream Guards. He said that people always talk about body positivity, being big is okay, and it's almost promoting obesity. Is a point of it, and I think there's an element of truth in that.
Yeah. Certainly, the whole point of being in the army is you're meant to be fit.
You're meant to be
fitter and stronger than the other side, surely.
It's like when you see fat coppers, you just think, correct, right, you're never going to get
There was a story just last week about cops being given XXL uniforms and how they're going to catch burglars. The other issue is healthcare workers. So there are huge levels of obesity among nurses, hospital porters and other medical professionals.
Yeah, but obesity is a problem across our society, and processed food and whatnot. But certainly when you've got 1 in 4 of our armed services being obese, that's an immediate problem for our defences and whatever. But also there's a little interesting thing here. There's 60 people have had liposuction surgery, and you're wondering, like, who's paying for that? It means the NHS paying for that? Is the MOD paying for that?
I think that's Al Qaeda is doing that.
You think it's a bit? But
the enemy are doing that.
Instead of shooting at just dropping McDonald's. There's another plug there. Sorry, other burgers are available. Right.
But it's not good, and you're wondering, how does it get to that point? They can literally be ordered to eat less or to go on a run. How are the people who are in charge not going, wait a minute, mate, you're a bit fat, off you go, 20 miles, run around?
There has to be a point when you go, you're 25 stone, maybe you need to get in the gym.
Yeah.
If you're a soldier.
Well, yeah, I mean, that's it. It's a simple question. When do we wake up to this crisis? We're pretending like it's business as usual, and it's not.
And it's not good for people's health. It's okay, the body positivity thing is okay, but ultimately, it is not good for your health to be that big. It's just not.
Did you see that thing was it 2 years ago, where the comic Sophie Hagen was basically complaining because they put out these adverts about cancer research, put out things saying that obesity is the second biggest cause of cancer, and she was like, this is body shaming, this is whatever. It's like they're trying to save lives here.
Your life.
Yeah. It was ridiculous. Like, this was like somehow they were bigots for it.
Well, yeah, that's like lung shaming smokers, isn't it?
That's ridiculous.
That's what's next.